Welcome. I'm Valerie. We've created this because weight loss medications are powerful tools, but your brain chemistry, habits, and emotional patterns drive your long term success. So there's a lot of noise about GLP-1 medications, peptides, metabolic treatments. So women are telling me that they're really overwhelmed, or worse, it's like they're cheating. This is your reminder, by the way, you're not cheating. You're partnering with your biology, and your brain deserves support too. So we believe that understanding the science behind these medications is just crucial for achieving sustainable results. By exploring GLP-1 drugs and how they interact with your brain, you can gain insight into the physiological changes that occur and how they might impact your hunger and satiety signals. Yeah, but I always let people know medication alone is not enough. Your mindset and behaviors play a very pivotal role in shaping your journey. So, developing habits that stick require patience and practice. And we're going to guide you through strategies that create lasting change. We're also going to delve into that emotional side of appetite changes, helping you navigate the psychological aspects of weight management. Protecting your mood, metabolism, and identity is also very essential. So, we're going to provide guidance on how to maintain balance in these areas. So, together, we're going to empower you with knowledge and tools and just to embrace a healthier lifestyle and achieve your goals with confidence. I always like to just throw out a little medical disclaimer. I'm not here to provide medical advice, and I'm definitely not your provider. Always consult with your clinician if you want to make any changes, do anything different. And if you ever want to be my patient, I'm happy to give you medical advice. But in this setting, we're really just providing some education. We're going to just introduce ourselves first. So I get to introduce Valerie Brandt. I say Val because she's my sister.
I know. She's a powerhouse in the field of metabolic and weight management.
With certifications from both the American Nurses Credentialing Center and training through the IAPAM and AMET, Val brings a wealth of experience. Her unique integrative approach merges psychiatry, lifestyle medicine, and longevity science. And so by focusing on personalized evidence-based care, she assists clients struggling with anxiety, depression, ADHD, and stress-related weight changes. And her work aims to help individuals regain energy, focus, and emotional balance. And she's the only psychiatric nurse practitioner I know that brings the science of GLP-1s into her practice. Yes, thank you. Thank you for that introduction. And then Jessica Brandt, she is my sister, so I'll introduce her. So she's a certified life and health coach. She specializes in functional medicine and menopause. She is dedicated to empowering busy women to strengthen their confidence and well-being. Jess excels at translating really complex concepts into practical tools, and she draws on her background in learning, facilitation, and change management. Her warm, evidence based approach combines holistic health principles with mindset coaching and behavior change strategies to guide women toward leading their lives with clarity and purpose. So, together, we offer comprehensive and a nurturing approach at Brandt Wellness, helping individuals achieve not just physical, but also mental and emotional wellness. We're very passionate about that. So we're very excited to share with you our topic today. The whole purpose of our conversation is somewhere along the way, the conversation about weight became very polarized. Diet culture told women they needed to be thinner. The backlash from that told women they shouldn't want to lose weight at all. But the truth is way more nuanced, and that's something I really want to get into today. Weight, especially stored around the midsection, is often a metabolic signal. It can reflect insulin resistance, inflammation, hormone shifts, and changes in muscle mass that can occur during our midlife. Alternatively, I want to just say you could have a thin body, but not a good metabolic health profile. You might have low muscle mass, high body fat, and your lab work could also indicate some metabolic dysfunction. So, that said, wanting to improve your metabolic health is not vanity, it's biology. So today we're going to get into some topics here. We have a lot to discuss with you. Today we're going to delve into the fascinating and multifaceted subject of how GLP-1 drugs interact with your brain and the importance of mindset and behavior in this process. And so first, you can see our agenda here. We're going to just explore the mechanisms through which GLP-1 drugs work in the brain, how they help regulate appetite and metabolism, understand the interaction. It's crucial as it lays the foundation for just appreciating how these drugs aid in weight management, but it's not just about the drugs. It's also about mindset and behavior and how that plays a significant role in all this. And so we'll discuss the importance of building sustainable habits. And again, this isn't about willpower. It's about creating a supportive environment and routine that just make healthy choices easier. And so we'll also touch on the emotional ramifications of appetite changes. And it's normal to experience a range of emotions addressing these. And this can lead to just a more holistic and supportive approach to weight management. So first we'll talk about protecting your mood, metabolism, and identity, finding that balance, and incorporating lifestyle changes. And so by the end of all of this, you'll have a clearer discussion of how medication can support mindset and behavior strategies to achieve your health goals effectively. So we're going to start with the brain, and you are what you eat. Yes, and this is my favorite topic. I love nutritional psychiatry, so I can't wait to talk about our brain and how our brain really depends on the food we eat to stay energized and balanced, and especially our mood too, how that plays a role. So every bite you take basically sends a chemical message. Weight loss medications are going to change your hunger cues, but they don't replace good nutrition. Your brain absolutely depends on nutrient dense foods to stay balanced, energized, and resilient. Vitamins and minerals are the building blocks of our neurotransmitters. So this is where mood and food connect so much. And we need protein to maintain and build muscle. So no matter if you're on a medication or not, the goal is to eat a variety of food, most being nourishing if possible. I never like to label food good or bad or on or off limits. My point is just get as much nourishing food as you can because your brain likes it. And this is just practical generic advice that I bet any medical provider, dietitian, nutritionist, trainer, they're going to say, eat the rainbow. And when I say rainbow, a variety of colors of foods, a combination of protein, fiber, and healthy fats. That's just the essential part of keeping our brain healthy and happy. So as we dive into this fascinating world of weight loss medications and their interaction with our brain, now we're going to just think about and talk about how these medications communicate with just different parts of our brain to influence hunger and reward mechanisms. These are the areas of our brain responsible for regulating our appetite. And weight loss medications basically can modify the signals in these centers to help reduce feelings of hunger. And part of that is the reward pathways. These are crucial in the context of eating because they can drive us to consume more food for pleasure rather than necessity. But by influencing these pathways, the medications can curb cravings and the desire for that reward-driven eating. And this kind of gets me into our topic of dopamine. Dopamine is a neurotransmitter that plays a key role in pleasure and reward. So some weight loss medications work by adjusting dopamine levels. That basically leads to our reduced cravings and a more balanced mood. And then we can't ignore stress response. Stress can often lead to overeating, and certain medications can help manage this response and just reduce the likelihood of stress-induced eating. And I think what's interesting is that these medications provide a comprehensive approach to tackling weight issues by addressing both biological and psychological factors. So we're going to talk about just common weight loss drugs, give you a high-level overview. So I'll let Valerie this, and she's our clinician here. Sure, I do prescribe these meds. I think these meds are game changers for patients struggling, and they're not for everyone, and we'll get into that too. So you can take a look at the slide. We got our semaglutide or tirzepatide. So I'm going to get into some of these. Just this gets them in a visual form so you can see what we're dealing with here. There's a lot of media attention around weight loss and diabetic treatments, just treating diabetes in general. Semaglutide and tirzepatide have become household names. Everyone knows the Ozempic commercial and Serena Williams and her commercial injecting her Zepbound on TV. But both medications have shown really impressive results. And if you understand the key differences, it can help you have a more informed conversation with a licensed medical provider about which option might be right for you. So semaglutide is a GLP-1 receptor agonist. That's like the fancy way of saying GLP-1 for short, GLP-1 receptor agonist. GLP-1 stands for glucagon-like peptide 1. It mimics a natural hormone in your gut. We all have GLP-1 already in our gut. We have this. This just adds more. So it's mimicking this hormone, and it helps regulate our appetite and blood sugar levels. Semaglutide is going to slow down how quickly our food moves through our stomach. And then we feel fuller longer, reduces cravings, and this improves how our liver manages our blood sugar as well. And so if you think about semaglutide, we're getting into Ozempic and Wegovy. Ozempic is for managing type 2 diabetes, and Wegovy is for weight loss, FDA approved. But just letting you know, semaglutide is what the generic version. You know how that works in medicine, right? Ibuprofen is Advil, acetaminophen is Tylenol. Semaglutide is Ozempic, right? Tirzepatide is a dual agonist. So I want to talk about that next. So that's going to be when it's called dual for two, meaning it activates GLP-1 and GIP. Now, it's a mouthful. Glucose dependent insulinotropic polypeptide receptor. So we've got two things happening here, but the addition of GIP enhances the effects of the GLP-1. Potentially, just what it's doing is offering a stronger and broader impact on blood sugar control and weight loss. The biggest thing, the effectiveness of weight loss, is that both medications are very effective for weight management, but tirzepatide has shown slightly greater results. So semaglutide leads to about 15 to 16% reduction in body weight, whereas the tirzepatide can result in 14 to 18% weight loss. And many clinical settings report even greater success than that. For individuals whose primary goal is weight loss, tirzepatide's edge in effectiveness might be a deciding factor. And most patients do report less nausea on tirzepatide, which could be a deciding factor for some. Appetite for some people can be emotional. Stress, transitions, fatigue, frustration, like all of these things activate that I need something signal. And GLP-1s pull the physical hunger, but that emotional hunger still needs attention. And so when women have these cravings that just suddenly disappear or drop, they just say, I feel strange. Like I don't know what to do, or I didn't realize how much eating helped me cope. And it's totally normal. It just means your brain's rewiring. But I think by understanding and nurturing the emotional side of hunger, we can create a balanced approach to our well being. And so we want to kind of dive into some of that a little bit more. If you're on a weight loss medication, you're going to be adjusting to this new phase. And it's really important to explore other fulfilling activities that can replace the emotional role food once played in your life. So engaging in hobbies, exercising, spending quality time with your friends and family, that can bring a lot of joy and satisfaction. So you have to remember the transition is a journey of discovering new ways to nurture your well-being physically and emotionally. And I just let my patients know, consider keeping a journal, track your thoughts, track your feelings during this kind of transformative period. It can really provide insight into your evolving relationship with food and help identify patterns and triggers that previously led to a lot of cravings. Additionally, the mindfulness practices such as meditation and yoga, they can enhance your awareness and just help you stay grounded. I just let my patients know, celebrate your progress, be patient with yourself as you navigate these changes, and kind of embrace this opportunity to redefine your identity and feel like you're in harmony with your new brain chemistry, your wellness goals. This is a total package. And I think sometimes that we miss that part when it comes to these medications. Jess is going to talk about identity as a health and life coach. This is a huge part of what she does and helps our patients with. Yeah, it's been interesting. So when this medication starts to work, you're not just losing weight, you're losing that old way of being, and just how you soothe, how you reward, how you comfort, and just reset yourself. It totally shifts. And I work a lot with my clients on just this very thing. And your identity just needs time to adjust. And that's why this mindset work we do matters just as much as the medication. And so mood and metabolism are linked. We can't ignore that component too. For feeling down, feeling anxious, sometimes we can't ignore the fact that this could be connected to our blood sugar, right? So if your blood sugar is erratic, your mood's going to be erratic. These medications really help stabilize our appetite, but you've got to stabilize your energy too. And that's why we talk about protein, fiber, movement, sleep, stress reduction. These all come into how our mood and metabolism are linked. And that kind of leads me into, again, that whole reward system and how this reward system can change. And dopamine changes. I'll talk about dopamine. Food becomes less exciting when you're on these drugs. And if nothing else in your life feels exciting, people say they feel flat. And this is why we talk about building new rewards, moving your body, accomplishing a task, doing something creative, and just connecting with your friends and your family. That can give you that dopamine boost you need that you may used to be getting from food. It still needs that joy, and you have to give it that joy. And so it'll be interesting talking about just the role of willpower in all this as well. Oh, sure. It's easy to say, go do something fun. Yeah. Boost your mood. So that's really tricky. Or the old things that helped us feel good were interrupting, right? The other point we're really trying to make too is the GLP-1 medications aren't a shortcut to anything. They're really just scaffolding. And again, getting into this building supportive habits, identity change, doing things different. Your brain's working a little different. So I want to give women permission to say to themselves, you can't rely on willpower alone, and that's okay. And the GLP-1s are not a shortcut. They're scaffolding, and without good habits, routines, and supportive environment, the old patterns return the moment the medication stops or stress spikes. This is kind of what our brain does. It defaults into what it always is used to doing. So that's where a lot of the supportive habits are a huge part of our program. I don't want to plug our program at this moment. My point is, like, it's a total package, right? You've got to work on identity and new habits. But also, when your body starts to change, you can lose some muscle with fat. And that's a recipe for disaster and not the goal. So we always want your body composition to change. So we're going to get into that topic as well. But first, we're going to do some myth busting, because I think we've heard, not all of it, I'm sure, but we've heard a lot of it. And so I think we have 5 or 6 myths and facts we wanted to share specifically, because they can change the whole conversation if you're coming in with maybe not so correct set of facts. That's fair. That's fair. So let's start with the first myth. GLP-1 medications are just weight loss drugs. What's the truth, Val? In fact, GLP-1 medications have other benefits as well. They're not just for weight loss. They decrease hunger and decrease food intake, but they also help people lose weight. They were first developed to treat type 2 diabetes. And GLP-1 medication can cause your body to make extra insulin after you eat, which also helps lower blood sugar. GLP-1s have other benefits as well. They can help improve lipid disorders and fatty liver disease, lower blood pressure, reduce the risk of kidney and heart disease, delay the progression of diabetes complications and diabetes-related neuropathy. And most of these drugs are given through injection, but there are some that come in pill form. The biggest breakthrough, I think, is that sleep apnea. The FDA did approve Tirzepatide for sleep apnea treatment. So that's a game changer. I don't want to ignore that. So there's a lot of benefits. It's not just weight loss. Yep. This is my next myth. All prescription weight loss medications are the same. That can't be true. Fact, there are 11 GLP-1 medications that are approved by the US Food and Drug Administration. So there is some overlap, but they all affect your body a little different. They don't all have the same treatment goals. For example, drugs like Mounjaro and Ozempic treat type 2 diabetes, whereas Wegovy and Zepbound treat overweight and obesity in people with comorbid conditions like high blood pressure. There are some meds you take daily, some are weekly. I heard they're working on a monthly one. There's oral pills. There's lots of choices. These have been around for a long time. They're actually not that new. Next myth. Anyone who wants to lose weight should take a GLP-1 agonist. The fact is, whether or not you should take a GLP-1 actually depends on many factors, including your current health and medical history. So I really want to get into that. If you're pregnant or breastfeeding, trying to get pregnant, that one's even up for debate at this moment, by the way. A lot of research coming out. These things change constantly. They are getting so much research out. Personal family history of medullary thyroid cancer or multiple endocrine neoplasia. Those are hard stops. And then there's also a lot of nuance with disordered eating, known eating disorder patterns. That one can be tricky. Yeah. So it's a very individual and personalized conversation that patients have to have for sure. It's not super black and white, but there are some hard stops. The other thing we hear a lot is insurance does not cover GLP-1 drugs. Is that true? It depends. Yeah. That's its own navigation. But I think that's a big hang up for a lot of patients that want to be on them, actually. For some insurance companies do cover them, but navigating the coverage can be a little tricky. In many cases, you have type 2 diabetes, but for weight loss, sometimes you have to do a little more work if you're on the prescribing end of things. But as a patient, sometimes you have to do a little work too. You have to collect some medical records. So if you had a sleep apnea test done, a sleep study done, you have to provide that and submit that to insurance to help get it covered. You need records of high blood pressure, high cholesterol, some other obesity-related condition. You might have to jump through some hoops. Some plans do require prior authorization, which your provider will submit, and then tell them why you need the medication, why you qualify for it, and then sure can decide if they want to pay. And then it might be a hassle, but I always tell people, don't let it stop you. Let's just keep it going. And there are some prescribers who do find it a hassle and don't want to do it. I do the best I can for my patients to get coverage so they don't have to pay as much and make it more affordable. Let's do another myth. I think we have one or two more. GLP-1s are the easy way out. Oh, we hear that from people sometimes. Dude, that is a myth. No matter how hard someone tries, how many lifestyle changes they make, there are factors like genetics or medical conditions that can make losing weight really difficult. In these cases, GLP-1 medications are a game changer. I always just let people know obesity is a disease. Just like bariatric surgery, GLP-1s are medical treatments. They're not cosmetic ones. And I think the tricky part from the mental health side of things is there are medications that we prescribe in mental health that cause weight gain. And that's unfair, isn't it? To say, here, this is supposed to help you feel better, but I might also cause some metabolic problems for you. Just letting you know, there are just meds that can make things worse. So I just feel like it's only fair to offer these options for patients, and they should ask about them and not feel bad about asking. I think that's the whole thing is just reduce the shame and just say, I'm stuck, I need help. And I think a lot of times they've been dismissed so many times that they don't want to ask for help anymore. And this last myth is related to the one we just talked about. If you take a GLP-1 medication, that's all you need to do. They're not magical. No, they are not magical. No. But the real fact here is that GLP-1s might be a key for helping people manage diabetes or lose weight, but they're not magical. Maintaining a healthy diet, getting physical activity, those are very important. And it's really a group of activities. And sometimes they start on the med and it's a catalyst for some of those lifestyle changes that they've been told to do for years on end that just they struggle to do. Eat well, exercise. Sometimes the meds get them going on that path. And that's where the magic does happen. We're going to talk about things that are magical. Or you hear my hair's falling out stories. That's a nutritional deficiency, low on iron, low on B vitamins, low on zinc. It's really just, I'm not nourishing my body. I'm not eating healthy foods. Yeah, that's the biggest thing, is a healthy diet. And we can circle back to my nutritional psychiatry plug. Eat well for your brain and for your hair.
This is a perfect segue into, if you are on GLP-1s,
What are the non-negotiables to make these medications work sustainably? These are the top 3: protein in every meal, movement most days, and nervous system reset. A lot of people do the morning brain reset ritual. And these habits really just stabilize your mood, your energy, your cravings, and they're really what make the medications work really well. And so as you incorporate these, you could really see the transformation. And a lot of these are just small, consistent steps. When we work with our clients and patients, it's just these conversations we have to have. Aim for movement you enjoy, incorporate protein into every meal. Give yourself a moment each day just to recenter your mind, whether it's meditation, journaling, or just enjoying a cup of tea. It's just this idea that all these work together as a system. And without that system, along with the medication, it's just really hard to see any sort of results or the goals you're trying to meet. And so this is all about making the medication work with your body, not against it. What gets in the way? Life.
what gets in the way, especially for women over 40? I would even say younger women who have young kids at home and they're in their 30s, for example.
I always tell people, you're probably not lacking any discipline. Actually, you're just carrying too much. You're carrying too much. This season of life is really busy and demanding. I think some women in their 40s too, we call it the sandwich, where they've got kids and parents that they're taking care of, and that's super challenging. So really at this time, recognizing how busy and demanding life is, just need more alignment and not intensity. We don't need to make things harder or more stressful, right? So recognize self-care is crucial. It's not an indulgence. It's really a necessity, creating a foundation that supports you in every aspect of your life, and just considering integrating small, manageable changes, and that can create a real ripple effect of positive outcomes. Focus on nourishing your body with balanced meals. Make sure you're including protein to sustain your energy levels through the day and maintain your muscle mass. Incorporating movement into your routine, whether it's a brisk walk, yoga, strength training. You don't have to do all the things every day, but these things boost your mood and keep your body really resilient. That's a whole other topic, exercise and mental health, by the way, but that's for another day. Don't underestimate the power of a morning brain reset ritual, like maybe a meditation or journaling or just a quiet cup of coffee where there's not any stimulation. You just get a moment to yourself. Set a positive tone for your whole day. Our whole goal is this is not about pushing harder. It's about finding some kind of harmony. Let's use the word harmony. Harmony, just so that what you're doing aligns with your values and you can create a sustainable way of being. I think that's the biggest thing. Back to the diet culture, it becomes this all or none, do it all, pass, fail. And really, we're creating something sustainable. That is the goal. And another big missing piece of that is nervous system regulation. What does that mean? If your brain's in fight or flight, your weight loss is going to stall, your digestion is going to slow down, you're going to have more cravings, you're going to just not have great sleep. And so even just incorporating a few calming practices can really be game changers for your health goals. And even if you're on these drugs, you really need to also think about your nervous system for the drugs to work better. So whether that's box breathing, inhale for 4, hold for 4, exhale for 4, pause for 4, doing that, grounding, just noticing what you feel in your body, having those morning rituals. Just, I think a lot of people I work with, women, just managing those transitions they have. How do you wind down from work? How do you get ready for bed? How do you pause mindfully during the day between all of your meetings? And just incorporating some of these practices can really help calm that fight or flight, which will then support the medication working and all the other healthy habits you're doing. So nervous system regulation is a huge component of what we do as well in all of this. And that ties into the next piece of your relationship with food changing and going back to that sense of as your hunger is shifting, you start to feel a little unsure. What's my portion size? Am I full? What are my cues of I'm hungry? Are they dampened? I don't know. And just feeling satisfied. This is why it's so important to create a gentle structure for eating. I always say less restriction and more guidance. So start by tuning into your body's signals, practicing mindful eating. Pay attention to when you're truly hungry and when you're full. And this might involve slowing down, And that's that nervous system regulation. Slowing down during your meals to savor each bite, which can help you identify your body needs a little better. Incorporating a variety of foods that provide nourishment and enjoyment. And I think balance is the key here again. And choose it, just the meals need protein, healthy fats, carbohydrates, and lots of color for fruits and vegetables. Hot tip, exchange fiber and carbohydrates with fruits and vegetables. Everyone's so afraid of carbohydrates. These are fruits and vegetables. This supports our physical health and contributes to our mental health and well-being. Again, building blocks of our neurotransmitters. Staying hydrated. Sometimes we do mistake thirst for being hungry. You got to keep water handy throughout the day. The flip side of that is some of these meds can squash your thirst drive. I don't feel thirsty. Noon is upon us. I haven't had a drink of water yet. Why do I feel like this? Oh, drink the water. I didn't drink water because I don't feel thirsty. So sometimes we have to do things that are guided. I'm not thirsty, but I need to do it anyway. And just be kind to yourself. Develop a healthy relationship with food. This is a journey. I think a lot of people don't have a healthy relationship with food because of all the mixed messages we're constantly getting. It's a journey, not a destination. So we have to be okay with some flexibility, listening to our body's needs, and allowing ourselves to just enjoy the process without all that self-judgment.
Yeah.
I'm passing, I'm failing, I'm good at this, I suck at this. Today's a bad day, screw it. It's going through the process and being okay with that. Yeah. And again, when we zoom out a little bit, what's the goal here? It's not just weight loss. It's energy, it's clarity, it's confidence, it's feeling like yourself again. This whole process is just as much about emotional freedom as it is about physical change. And especially when you think about weight, we're really focused on that weight stored in the midsection because that's the metabolic signal. And that's where we see the insulin resistance, the hormonal shifts, changes in our muscle mass that occur during midlife. And we'll say this again for those in the back, wanting to improve metabolic health is not vanity. It's biology, and improving your metabolic health will improve your mind, body, and your mood. Yeah. So this is where we'll start talking a little bit about how we approach things here at Brandt Wellness and just some of the ways we work with our patients, just so you have an awareness of that. So let's talk about our approach. So how do we do this at Brandt Wellness? Our approach blends nutritional psychiatry, metabolic health, behavioral coaching, all three together. It's treating the whole person, your brain, your habits, your hormones, and your life. This is our model. You can see how those things overlap. This is a key point. If you don't remember anything today, remember weight alone is not a helpful metric. That's true. We look deeper than that. So how do we approach our patients holistically? We approach midlife health through the lens of mood, metabolism, and nervous system regulation because these systems are very connected. And as you can see, weight alone is not a helpful metric. Let's look at this body composition example. Person A weighs 155 pounds, muscle mass is low, visceral fat's high. Person B, 155 pounds, muscle mass is high, visceral fat is low. Their blood pressure is normal, their cholesterol is normal, their blood sugar is normal. Their ADHD seems moderate to low. Anxiety and depression scores are low. These people are the same weight, but look at that. Our blood pressure's high, our lipids are high in person A. So we can't just go, oh, you weigh 155 pounds, you're great. It's more complicated. That's how we do things. We look at the whole person. We break it into 3 sections. So having said all that, after learning so much about your brain and body, this is the part where we provide you with information for how to work with us. If you're interested in being a patient or you're a provider and you want to place a referral to somewhere to send your patients. So just, this is not a sales pitch. This is just so you can learn about what we offer. So if you or someone you know could benefit, you just know what we have. We're not going to email you. We're not going to call you. We're not going to message you. So we offer a 12-week program. It's called the Lighten Up Mind, Reset Your Mood and Metabolism. We want 12 weeks because it takes some time. This isn't a crash diet. This takes some time and structure to do. Let's tell you a little bit more about our 12-week program. And if you're interested in working with us, getting started is actually pretty easy. What we do is we'll schedule an intake. And before your intake, you're going to get some lab work done. It's a comprehensive lab review and mental health evaluation. So you're going to fill out lots of mental health assessment forms, frankly, and you're going to get a huge 14 lab panel completed, which is very integrative psychiatry approach. There's a lot of other things mixed in it that maybe your average doctor is not doing. And then when you leave that 90-minute intake, you're going to have a pretty solid understanding of 12 metrics that examine metabolism, mood, and cognition. And when I say cognition, I'm talking focus, memory, brain fog, those kinds of things. And it's going to help you determine, it's going to give you a roadmap so you can move forward with your health goals. And after the intake, you get 2 choices. If you're interested in working with us, you can enroll in our 12-week program,
Or if you don't want to take any action after the intake, you still get all your labs, you get your mental health evaluation, you get recommendations. And if you do not choose any ongoing treatment, that's okay. Most women do work on their goals and they're very excited and motivated to work on their goals. So after your intake and lab review, you can do our 12-week program. We have 3 levels of support because, again, everyone's a little different. The things they need are a little bit different depending on that lab panel and interpretation. They might want some different things. So the first option we offer people is we just call it the Jumpstart.
Yeah.
And it's really self-guided. It's an approach to lifestyle changes, not medication. You get that full intake lab review, and then you get an eating guide, a training guide, habit trackers, weekly educational emails, and 2 follow-up visits for that medical oversight. And so this is probably the most hands-off for those self-starters who are like, okay, I think I know what I need to do, but just give me a little bit of help.
Yeah.
Jumpstart's perfect for that. So the next one though is Momentum, which is for those women who just want that GLP-1 support and a little more guidance.
Yep.
And so why don't you talk about that one? Yeah, and this is the big game changer. So the Momentum program is you're going to get GLP-1. It's included. So there's no surprise of how much does this cost. It's included. But this one's important because these are the women who are already doing a lot of supportive things, but they want more structure, support, accountability. And this is coaching every other week. So you get to see me as your clinician. You get to see Jess as the coach. And you get your medical oversight if we're having a GLP-1. So this includes everything in Jumpstart, more advanced labs, health coaching with goal setting meetings, bi-weekly telehealth coaching so you can meet your personal goals. The weeks we don't meet, you can expect an email from Jess checking in on you and supporting you. And then once a month, you'll come into my office. We'll check in how you're doing, address symptoms, body composition. Our most supportive program that we also see a lot of women participating in is our transformation. And this is really for those women who they're all in. Yeah. This is high touch care. You get to see Val a lot. You see me weekly, but with this, you get extra peptides that support weight loss with the GLP-1s. You get custom workouts, weekly coaching. So you get everything in Jumpstart and Momentum, plus more personalized plans, more coaching, and more support. So these are for those women who are ready to see big results and just need a lot of support. This is their package. It's for those women who are just ready to make it happen with their health goals. There's no wrong choice here. What do you need? What's practical? If you're ready to reset your mood and metabolism, we are here. You can book your intake with us and we're happy to help you. You can just go to our website and check things out, get some more information. You can always send us messages as well to our email. We're happy to help. If you want to learn more about mood metabolism and women's autonomy and health decisions, we have a free GLP-1 guide for anyone. Maybe you're already on one and maybe you just want some guidance, or maybe you know someone on one. Maybe they want some guidance. Thank you so much for joining.